We're going to get started. Apologize for a short delay. We have a good group out this afternoon, and I really appreciate everyone's participation. I'm Senator Jim Seward, and I'm very proud to represent this region in the New York State Senate. And I want to welcome everyone to this roundtable of the Senate Task Force on Heroin and Opioid Addiction. You know, it was in this very room just about 2 years ago, in April of 2014, we had a similar gathering. And since that time, 2 years ago, a number of steps have been taken to deal with this epidemic, which has, let's face it, it's torn lives, families, and in some cases whole communities apart. And shortly after the 2014 meeting and the other 17 forums that were held around the state at that time, a comprehensive report was issued by the task force, and a host of new bills were approved and later signed into law by the governor. Now, a key piece of that package was my legislation that expanded the insurance coverage for the diagnosis and treatment of substance use disorder. Now, that went actually into effect less than a year ago in April of 2015, and we're still looking at the impact of what that legislation can do. But whenever someone makes that decision, that life-altering decision to seek treatment, we need to do all we can to ensure that treatment is available. We may not get a second chance. And overall, as a result of the work in 2014, we at the state level, in conjunction with many local efforts, have enacted a multi-pronged strategy. You know, education and prevention, access to treatment, tougher laws, particularly directed at those who prey on the addicted. But let's face it, there's still much more work that needs to be done. And that's why we are here together today. We have an outstanding gathering of local stakeholders to discuss the situation as it exists today. And I'm very pleased to be joined today by two of our task force co-chairs, Senator George Amador from the Schenectady area, as well as Senator Terrence Murphy from Westchester County. Another one of our co-chairs, Senator Robert Ort from Western New York, is unable to be with us today, but he's represented by Kevin Crum here today. Kevin, if you would just thank you for being here. Also, we're delighted that the newest member of the New York State Senate, just elected last year in a special election, our neighbor to the south, Senator Fred Akshar, is here with us today as well. You know, the focus of today's session, this is an opportunity for us to discuss what is happening in this area, what's working in the battle against heroin and drug addiction, and also to identify what gaps in service remain and to help us determine what we can do at the state level to help fill those gaps. So those are the two thoughts I'd like, as we get into the discussion part of our program, those are the two things we would like to hear from you. What's happening today and what gaps remain and what more we can do to be helpful to the local efforts to combat this addiction. And with that, I would like to invite our co-chairs and my colleagues to make brief opening remarks. First, Senator Murphy.
Yeah, sure. First of all, thank you so much, Senator Seward, for putting on just an amazing forum here today. It is an honor and a privilege to be here and see so many professionals around the table here. And just a quick thank you to the students. This is an incredible opportunity for us for you guys to listen and for us to see what you guys need. You're the ground game. You're the ground game. So this is really important that you guys are here. I thank you for being here. But as the co-chair of the New York State Task Force, along with, like Senator Seward said, with Senator Amador and Senator Ort, I had the privilege of going to New Orleans this past summer on the national conference of state legislators, specifically with the pain management and the opioid abuse. And we're not alone here in New York State. I'll let you know that. There was 13 other states that were there, and we are doing some really good stuff. We just need to do more. And that's why we hold these forums, to figure out what else we need to do, like the Senator said, what gaps we need to fill. Just recently, I'm going to say actually Thursday, this past Thursday, I had in my district, in my hometown, a 26-year-old male overdosed and died. Went to the wake last night. 11 days earlier, previously, we had a significant bust of a 20-year-old male, female, $30,000 cash, 562 bags of heroin. This is what's going on. And this is why we will continue to hold these task force meetings around New York State till we get it right. And it is an honor and a privilege to be here. And I'd just like to thank Senator Seward for the invitation of me, allowing me to come up here and participate. So I am all ears. Thank you.
Thank you, Senator Murphy. Senator Amador.
Well, Senator Seward, thank you so much for hosting this roundtable and this forum. For all of the guests and all of the speakers at the table here, thank you for your time and your dedication to an issue that we have in the state of New York, which I believe is a true crisis. It's a crisis on our hand, and there's an epidemic with high heroin use and opiate over prescription and pain management that is creating this crisis that we have in New York. I'm Senator George Amador, and I represent the 46th Senate District, which consists of Schenectady, Montgomery, Albany, Greene, and Ulster counties, and it's a 5-county area. And I have the good fortune to be the chairman of the Alcoholism Substance Abuse Standing Committee in the State Senate, as well as co-chair with two good friends of mine, Senator Murphy and Senator Ort, on the task force of heroin and opiate addiction. And we literally have gone around the state last year, as well as in prior years. Our Senate conference has gone around, and we've had a whole host of roundtables as well as task force meetings to really understand firsthand the issues and what we're facing, what law enforcement, what DAs, what health providers, what sheriffs, what I believe the parents, most importantly, are facing with this crisis. And no question that someone who is bound with this addiction is very hard for them to shake or overcome. And it takes us all together to help fight this crisis. And I am so glad to see in the audience friends of all of ours, and that's the Friends of Recovery who is here, because part of the multi-pronged approach that that Senator Seward talked about with advocacy and education, with law enforcement, in treatment, is the approach of recovery, and how we can do a much better job in maintaining and keeping people in the recovery stage of life, and the support services that are needed for those individuals so that we can overcome and eradicate this problem. So thank you, SUNY Oneonta, as well as Senator Seward, for your hosting and for this very important topic being discussed today. Thank you.
Thank you, Senator Amador. And next, Senator Akshar.
Well, good afternoon, everyone. I'm Senator Fred Akshar. I am the newest member of this great majority conference, as well as a new member of the Heroin Task Force. Thank you to everybody who's sitting around the table. I think these type of roundtables are critically important to finding a solution to this issue. It's a community issue that requires a community response, and I think that these forums and these events that we're having today are a perfect example of folks coming together. So, Senator Seward, thank you for hosting this. SUNY Oneonta, thank you for allowing us to have this here. And I, too, want to reiterate what my colleague said. I thank each of you sitting around this table for your willingness to participate in this and help us find solutions to this issue. Thank you.
Thank you very much. What we'd like to do next is we'll go around the table, and if everyone would just simply introduce themselves and also just mention your role in being with us today. We'll start with you, Judge Burns.
Thank you. My name is Brian Burns. I'm an Otsego County judge. I preside over the adult or criminal family treatment court in Otsego County. And back in 2001, I opened a family treatment court for parents dealing with addiction issues whose children were either in foster care as a result or were in danger of being in foster care.
I'm John Meal. I'm the Otsego County District Attorney. I'm responsible for prosecuting all the crimes in the county. I've also been a member of the Otsego County Drug Treatment Court since January 1st of 2004.
My name is Joe McBride. I'm the Shenango County DA. I've been involved with drug court in our county since its inception under Judge Sullivan. I believe many, many years ago. I believe was one of the first in upstate New York. I'm also involved in our county organization and our heroin task force. I'm also have my staff and myself are involved with the drug court area, and obviously I'm involved in the prosecutions of all criminal matters, including drug matters in Shenango County. Thank you.
Richard Devlin, Otsego County Sheriff. Not only do we deal with the law enforcement side of this, we have the correctional side of housing inmates that are addicted and have underlying medical conditions. So we deal with a lot of different assets of this drug crime.
Thank you.
Doug Brenner, Lieutenant, City of Oneonta Police Department. Part of my job is to collect stats and notice trends in crime and try and address those. And we've seen it, of course, in the opiate addiction areas, and so I'm active in the opiate task force here to try and find some solutions.
Hi, my name is Craig DeMont. I'm the current Undersheriff of the Delaware County Sheriff's Office, and on behalf of Sheriff Mills, I chair the Delaware County Drug Task Force as well as the Drug Enforcement Unit at our office.
My name is Mike Covert. I'm the Cooperstown Police Chief. I started the PARI program, or Police Assisting Addicts Towards Recovery Initiative. We have 43 that started this program so far.
I'm Kelly Liner. I'm the Interim Executive Director at Friends of Recovery of Delaware and Otsego Counties. We are a 501c not-for-profit recovery organization. We run the Turning Point Recovery Community Center here in Oneonta and Delhi, and we promote addiction recovery and through advocacy, education, and peer support services.
Good morning, I'm Noelle Fike, and I'm one of the co-owners of the Crossroads Inn. We provide transitional supportive housing to individuals coming from rehab, prison, or jail.
My name is Joseph Yelich. I'm the superintendent of the Oneonta City Schools. I'm here to continue to promote multi-jurisdictional partnership that provides both response to the concerns, but a model for intervention on the front end. When you see this problem manifest itself in adults, you have to understand that they have children and those children are at school. And it may be our own students that are in crisis and need significant support. So the city schools and the Board of Education and my office are committed to creating and maintaining those partnerships that would help with that process.
My name is Jason Gray. I'm a paramedic and chief with Sydney EMS. Sydney EMS is a small non-for-profit ambulance service that's responsible for responding to not only your typical medical emergencies, but has seen a significant increase in the response to heroin and opioid overdoses. I'm responsible for overseeing the operation, training of staff, and looking for trends and how we can try to help and collaborate with our other local partners in stopping this problem.
Matthew Jones. I am the Director of Clinical Operations at the Bassett Medical Center in the Emergency Department.
I'm Dr. James Anderson. I'm the Medical Director of Behavioral Health Integration at Bassett, as we are working on the DSRIP project, the Delivery System Reform Incentive Payment. As part of behavioral health integration and as one of our DSRIP projects, we are working on a withdrawal management project that is focused fairly significantly on the problem that we're all here today to discuss, heroin and opioid addiction. Specifically right now, we are working to try to build and implement a medication-assisted treatment, or MAT program, based out of our primary care offices, to try to step up and do as much as we can to take a role in dealing with this difficult issue.
I'm Celeste Johns. I'm the Chief of Psychiatry at Bassett Medical Center, and I've been at Bassett for more than 26 years. I'm a district delegate to the Medical Society for the state of New York, and recently I also took on the part-time role of being medical director and direct treatment provider at the Otsego County Addiction Recovery Services here in Oneonta.
I'm Cheryl DeRosa. I'm the program coordinator of alcohol and drug abuse services at Shenango County Behavioral Health. I've been a member of the Shenango County Drug Court team for the past 3 years, and we just work to provide treatment, recovery, and prevention services in the community.
Hi, my name is Ruth Roberts. I'm the Director of Community Services in Shenango County. I'm responsible for the planning and oversight of for services for the 3 disability areas: mental health, substance abuse, and developmental disabilities. As a community partner, I think it's important for me to say that this is a complex problem that we're dealing with. Many behavioral health conditions tend to be complex. It requires multiple partners and those relationships at the community level, and there's no other way to do it than to get together like we're doing today, and also, of course, include those family members and the individuals themselves who are struggling with the conditions, and to come up with real, viable solutions. So thank you. I'm glad I'm here.
I'm Noreen Hodges from the Schoharie County Council on Alcoholism and Substance Abuse. I've been there since 2013. As a prevention agency, we have increased high schoolers' belief that drugs can be harmful by 72%. We go into every school and every grade and teach those skills and coping mechanisms and knowledge to hopefully prevent someone using drugs and alcohol in the first place. And we survey that every 2 years, and we have a good measure of success. We started an orientation program for drug court because we found that the AA rooms were somewhat becoming disruptive by people being in the AA rooms mandated through drug courts. So we wanted to open their eyes to what an opportunity AA can really be in their recovery. I chair our Schoharie County Opiate Task Force. We'll be showing the Hungry Heart. We're speaking to doctors, encouraging the Suboxone medication certification. We just started our Perry program in Cobleskill. We had our first person come in yesterday morning. I was just talking to Police Chief from Cooperstown. We have 10 angels trained to sit with that person while they're waiting to get into treatment in a 24 to 48-hour window. I know Cooperstown's had a good measure of success, so fingers crossed Cobleskill will have that as well. I'm also a state-certified recovery coach trainer and expert, or screening and brief intervention for youth and for adults, so we can get them help sooner and faster. And I'm also a district project chair, co-chair.
I'm Mary Rosenthal from the Alcohol and Drug Abuse Council of Delaware County. We are a prevention education agency, same as Noreen. We also do referral information, workshops. We also are big in the recovery support services. We have a recovery coach employed by us. I would like to see that get funded maybe through the state somehow so that we could increase how many we can have, because it's very important for the recovery coaches to be part of someone in especially early recovery, helping them, assisting them along their road to recovery. I'm a member of the Delaware County Drug Task Force, and I'm also a member of the Delaware County Drug Court.
Hi, everyone. My name is Chris Kemp. I'm the director of Delaware County Alcohol and Drug Abuse Services. We are a medically supervised outpatient treatment program. I am also a member of Delaware County Opiate Task Force, as well as a member of the drug treatment team and family treatment court team.
My name is Susan Matt. I'm the Otsego County Director of Community Services, so I oversee the 3 disability areas that my colleague Ruth identified. Otsego County also runs clinical services. We have an integrated service area, and we have been actively focusing on the treatment of adolescents since 2010. We see about 50 kids a year who struggle with addiction and have really been seeing that consistently. We also just are very happy to receive the Clubhouse grant that OASIS awarded, and excited that that will also enhance our ability to do services for the kids. We're also very happy that we now have a formal working relationship with our healthcare partner, Bassett, and that's really added a tremendous amount, both through the DISRIP initiative and through Dr. Johns and the conversations that are ongoing on how do we work together in addressing this chronic illness for everyone.
Good afternoon. I'm Julie Dostal. I'm the Executive Director of the Leaf Council on Alcoholism and Addictions. I'm also the chair of the Otsego County Opiate Task Force, which is a group of about 30 individuals, professionals, people in recovery, schools, medical professionals that are working together to address the opiate issues in Otsego County. LEAF is a council on alcoholism, like my colleagues Mary and Noreen, and we work in the schools and in the community to try to prevent an addiction before it starts.
Well, thank you all very much for joining us here today. And I also want to thank everyone in the audience, certainly our SUNY Oneonta classes. Thank you for being here, as well as so many community members who are vitally interested in this important topic. The only downside is that there's not room at the table for everyone, because certainly everyone's viewpoint is important. And we will be having among the participants here today, our format is kind of a roundtable discussion. But if anyone at the table or anyone in the audience has any written remarks that you have with you today that you'd like to submit, we will gladly accept them. Or if at a later date you would like to submit some written comments to the task force, certainly submit those to my office right here in Oneonta, and we will see that the task force receives copies of those written comments. Now, we are limited today to 2 hours in terms of our program. I know we got started a little late, so we'll end a little bit late, but we are limited to 2 hours because of the fact that the task force has a similar forum later today out in Penn Yan, and that's going to take a little bit of traveling time. There are no straight roads between Oneonta and Penn Yan. But with that, let's get started with our roundtable discussion. I'm not sure where to start, but I think I'll start here with Julie and Susan. I'd like to first let's talk about from those individuals who are directly involved in working with those who are addicted, in terms of what type of services and treatment are currently available, what gaps and voids still remain in this region of the state, what treatment programs, inpatient, outpatient, other options. We'd like to hear about. Let's talk about what's happening today on treatment and what more needs to be done and how we can be helpful.
Well, thank you very much, and welcome, Senators. And thank you, Senator Seward, for making it possible for me to speak at this forum. Glad to be here. I guess what I start right on the ground with, we're prevention, and we work to try to prevent a problem before it ever starts, prevent an addiction before it ever starts. And a couple of the things that we are actively involved with in that is the Otsego County Opiate Task Force. That group is working hard. We are on the ground. We started after the forum last time that you were in town, and this group has been busy since then, and we have been working on issues such as housing, such as trying to connect people to recovery resources. One of the things that we're working on with the task force is a website and an app design called Recovery Seek. You can look us up at recoveryseek.org. There is a very rudimentary website up there where we can get people help if they need to find help immediately. People were not knowing where to go for resources, and we're going to get that out there and get it really robust so that people can find resources. The other thing that we're doing actively and working on this particular issue is being quite involved in the district process and working with our partners in the medical community to try to address some of the issues around opiate addiction. Otherwise, we're doing prevention. We're busy in the schools. We're busy in the community. We're working with kids. We're working with families, and that's what we're doing in the community. So that's the active stuff that we're doing. Where we see some needs. Is that next? Is that what you'd like to hear next? Okay, then let me go right into that. So I want you to know that in the best of all worlds, we do work to stop an addiction before it starts. So before I really go into the local conditions that get in our way, I want to speak about a larger issue that really gets in the way of prevention sometimes. We can't prevent one addiction while being double-minded about the harms associated with all addictions. And the opiate crisis is bad. It's terrible. According to the CDC, it killed approximately 25 New Yorkers last year, and that's not acceptable. It warrants a full court press and receives much public attention. Also, according to the CDC, there are about 4,000 New Yorkers who die yearly from alcohol-related causes. It warrants a full court press, but the commodity responsible for such harm has been elevated to the status of economic strategy. It sends a mixed message, and addiction is addiction, whether it's to a legal substance or an illegal substance. Just think how many New Yorkers we might save if the same public full court press were applied to a substance which causes more harm and creates more costs than opiates. So I just wanted to put that on the table. With the Opiate Task Force, we work really hard, and there are a couple of things that we've identified. And we talk about this as we get together. First, a large number of residents needing treatment have only been successful in finding that treatment out of state. While administrative roadblocks, paperwork, insurance companies, and lack of bed availability make it nearly impossible to find treatment in state. We should not have to send our loved ones, our friends, and our family to Arizona, California, Florida, or North Carolina to find life-saving treatment. With a state as rich in resources as New York State, we ought to be able to find resources in New York State. Housing and transportation for those needing sober environments in their recovery are either extremely limited or are laden with mounds of paperwork and rules. Individuals can end up right back where they got high in the first place, and this is no way to support recovery. In this, I would like to give a big shout out to Crossroads, which is a place that is working in our community. Treatment on demand is necessary for people struggling with opiate addiction. The window of opportunity to welcome a person with addiction through the door of recovery is very small. Yet we're treating addiction like it's someone else's problem. Would we send any other medical patient in acute distress out the door with just a phone number or possibly an appointment in 2 weeks? No, we would not. And why is the often fatal disease of addiction handled differently? And finally, prevention. Statewide media campaigns and informative websites are but a small piece of the prevention puzzle. New York State has the finest, most active prevention system in the entire country. We are the experts that you have paid for and supported. Use us. It doesn't make sense to spend prevention money in a centralized way when conditions on the ground vary from village to village, county to county, upstate to downstate. I submit to you that the prevention experts who know the ground truth to their community can be the experts who can target local conditions much better than a broad brush media campaign. Please consider this as you look to solutions. Thank you for your time and your consideration in hearing my testimony. We are heartbroken in our area. Too many are suffering, too many are dying, and too many families are impacted in an extremely negative way. You have the power to make the difference, and we respectfully ask that you do. The staff of LEAF are always available for additional information and expert consultation, and it would be our honor to do so. Thank you.
Susan, did you have anything to add in terms of what's happening locally?
Sure. I'm going to kind of come from two perspectives. One is the county director. I oversee and see how mental health issues are addressed and addiction issues. But also, I have over 30 years in the treatment arena. I've been a clinical social worker for 30 years and have worked and had the privilege to work with people who struggle with addiction and their families. The approach that I'm really promoting for us is really a broad brush prevention agenda, looking at really people that are at risk. I believe a child who struggles with depression, who's been a victim of violence, is at risk for suicide, addiction, multiple problems, jail, incarceration. All the research supports that. So we are really looking at a broad brush, trauma-informed community. That's where I think we've had conversations and are interested in going, of how do we really raise all of our youth up to being healthy and functional and members of society. On the treatment side, I think there's many challenges, and I practice in an urban area. There are many challenges to the rural areas, is economy of scale, that there's things like the housing initiatives that come out, work for a model of 25 beds. 25 beds don't work in the rural communities, so we need housing models and housing options that will work. We have them on the mental health side. We have stipends on the mental health side. They give a lot of flexibility, but we don't have them for people in recovery. And I see all the things that we have for people who struggle with mental illnesses, and we do not have them for people who struggle with addiction. We don't have care management. We don't have housing. We don't have a lot of services that we have for people who struggle with mental illness. I think the other piece on the treatment side, and this has gone on forever, is that we treat addiction so differently than we treat other chronic illnesses. There is no chronic illness in which you get half the treatment you need. If a doctor says you need 10 doses of chemotherapy, we don't say, here's 5, good luck. I mean, it's just crazy and insane the way we treat this illness, and it's taken its toll over the years, and I think we really need to be pushing that it be treated as on equal level and equal footing and as an equal chronic illness as everything else. And I think some of the legislation has been instrumental. I think the parity laws, the insurance stuff, removing the, you have to fail first. I mean, who says that? You don't say that to any other person who has a chronic illness, but we say it to addiction. I think the other things in addiction, what we struggle with in treatment is certainly access. None of our beds are local, so they're at least an hour to an hour and a half away. Even though there's a bed, and I know there's a new bed availability that will tell us right now how many beds are out there, getting that person from the emergency room at Bassett to that bed is where the rubber meets the road, and that's where there's a breakdown and no supports in that happening. I mean, it's transportation, it's insurances, it's all of those things. Our average is 4 to 7 days into a residential program, and yet Chief Covert will share with you he's getting people into treatment in 24 to 48 hours in Florida. Something is wrong with this picture. When law enforcement is having better success in getting people into treatment, now they're all going out of state, then we as treatment providers can get something is broken with the system. And I think families have been saying that, and we really need to listen, that we need to have a system that is available, that is accessible, that we can find ways to get people from A to B. People, when they're ready to seek treatment, their life is usually a disaster. They don't know if they have Medicaid or Medicare or whatever. They haven't really thought about it. So there's a lot of things that take work to help them get ready and to put those things in place. I think the other things with treatment is, we have a shortage of skilled professionals. We have a shortage on the medical side. We've struggled. Our clinic went 2 years without a medical provider, and this is the first time we're actually prescribing Suboxone now that we have Dr. Johns there. So it was a huge uphill battle. We could get doctors from upstate to come down, which was 6 hours, 4 hours travel for 2 hours of clinical service, and that becomes cost prohibitive for us. So we need treatment that is funded at a sustainable, reasonable way. I believe that's one reason why we have a shortage of treatment, is that it's underfunded. It's not paid for at a reasonable rate, and no one goes into it expecting to make money. We just expect to break even and be able to cover our costs. So when we're paying for this expertise and then we have poor insurance reimbursement or poor payment, you just can't do it. And our clinic was certainly on the brink of having to make the decision that we weren't meeting our regulations and we may have to close. So I think the regulations have been a barrier. I know OASIS has been working on those, but we need to look at what has gotten in the way of developing a service system. Why isn't there more private providers at the table here? We talk about the public as the last resort. It's the only resort. So what has happened that there's no private sector development in this area? I mean, there's a huge need for it, but there's not private sector development, and that's a good business question to be looking at.